What guidance would you give to healthcare leaders across the country who are doing this? Not all of them are at a UC San Diego. Not all of them are at a academic medical center with grants and other things to really look at some of this stuff. When you think about the range of different health systems, what guidance would you give them as they're trying to figure out this AI journey?
Yeah. Well, Bill, that's a really simple question with a complicated answer. UC San Diego Health has some wonderful, smart faculty members, but we're a hospital serving the needs of the county, the underserved. Our margin is not huge. And this gift has allowed us to do things we might not otherwise have been able to do. And I recognize what you're saying, which is a lot of health systems are operating on these grocery store margins and aren't well positioned to sort of lead in this. And I guess I would advise two or three things. The first is lean in, right? Learn, educate yourself. And that doesn't mean just the vendor's education. It means going to conferences that are academic in nature, perhaps even considering chief AI officer type roles for folks that can help to guide a safe journey on this timeline. The second is we really have to demand meaningful outcomes. And I gave the sepsis example earlier, and yet just a couple of weeks ago, the FDA approved the first ever sepsis AI algorithm, and it was based on some data that the vendor provided that did not include any clinical outcomes. It was algorithm outcomes, right? And I think we just need to be very cautious because you ask any patient, what they're looking for is meaningful outcomes that matter to them. And so we have to be careful of that shiny object syndrome, AI for the sake of AI, but rather really focus on what it's going to help us to deliver, right?